I'm Tamara Alhambra, researcher at Polybienestar Research Institute at the University of Valencia in Spain. And I'm going to present how the lessons learned from the experience of conducting the maturity assessment. And for that, we selected a qualitative approach based on focus groups. In total, 9 focus groups were conducted in the regions and countries participating in the Zero Co-Exchange project, and the following lessons learned has been extracted. Please, next slide. In regard to the experience of the regions and countries in the different use of the Zero Co tool for the maturity assessment, the following positive aspects were highlighted. So the individual assessment, always followed by a consensus meeting, were highlighted as the most positive aspect of the tool. The tool has been found to facilitate the reflection on integrated care, and it also supports creative and critical thinking about integrated care. The self-assessment process facilitates the discussion among different levels of stakeholders, which is always useful to gather and put together different visions and foster interdisciplinary discussions. These discussions were found to be useful for aligning the theoretical approach to integrated care implementation with the current practice. Next slide, please. But also different improvement aspects were spotted. The first one was the language issue. And in regard to this, we have heard from the different presentations that a lot of work has been going on and in improving these aspects. And it must also be said that the latest version of the tool presents lots of improvements in this aspect. The web tool was found not to be clear or very easy to use for everyone, and support was needed in some of the maturity assessments. A better description of the tool dimensions and scores was also suggested as an improvement, because there were difficulties in distinguishing different scoring levels and some dimensions as well. But again, several improvements were done in this matter as well. The next slide, please. In order to know more about this self-assessment process, different insights and outcomes were collected. So the self-assessment provides useful information, and it unfolds blind spots. It presents a clear picture, as the former presenter was saying, of the health and care systems for integrated care. So the final matrix reflects the system situation. In the self-assessment, it's very important to analyze data and translate them into corrective actions in a faster way in order to implement or make the change into or towards integrated care. The conclusions extracted from the self-assessment must be shared with all the key actors in order to facilitate this integration or this implementation. And even though that is a subjective tool, it allows comparison between different systems. And next slide, as a final lessons learned, some of the improvement aspects for the effective implementation of integrated care were highlighted. So one of the barriers for implementing integrated care was found the lack of clear constructive communication and knowledge sharing between all the groups of stakeholders involved in the implementation of integrated care. Also, the importance of hearing from uninterested people or people who are not easy to reach. Also, the implementation or the deployment of consistent and sustainable action plans and easier or simpler pathways of information for integrated care were also found as a facilitator or as needed for the implementation of integrated care. Also, the political support and funding, and working together across organizational boundaries in order to progress towards the implementation of integrated care. So those are the lessons learned from this first stage of the project on the maturity assessment.